blood components. Medical devices, which are also could be a harm for the patient, so we have to deal with it in the approach. And it's always the plan to check the Deming cycle. Follow. Okay, so we have the process now of the KDQ procedure, of the certification procedure, and then
two more minutes, gentlemen. I'm sorry.
we're almost at the end.
Okay,
Yeah.
almost at the end. Almost at the end. Just a few words about KTQ. Actually, as the name of the company says, stands for Cooperation, Transparency, and Quality in Healthcare. And one of those things among the thing of cooperation, they don't call the people that come to make the certification process, they don't call them auditors, they don't call them surveyors, they call them visitors. So they are considered colleagues who talk about quality management and to try to help in a continuous improvement approach to help colleagues from other hospitals to improve the quality management of the hospital. So a big point is trust. And the procedure begins with a self-assessment. So actually a hospital buys the catalog, costs around $100, that's it. And the catalog they take, and then they maybe have a consultant who has experience with the catalog, and they make a self-assessment with the catalog and write a first report, like a self-assessment report about themselves, how they would say, how they judge themselves. How many credit points do we give ourselves? And this is then handed over to intermediate corporation that is in charge to overview the catalog and to overview the whole procedure. That then starts with a step 2, where external assessors, or we call them visitors, it's 3 of them, 1 doctor, 1 nurse, 1 manager. So that all those aspects of management of the hospital is represented. They come and just look at the report and say, okay, according to their report, we would consider those many credit points. And then the certification agency, the intermediate agency, then starts to overview this. And then we actually come to step 2, where the self-assessment becomes an external assessment, where the visitors visit the hospital. It takes 3 to 5 days, depending on the size of the hospital. And then they make an external assessment. And each of those criteria that we have been talking about have to meet in average in each catalog 55% of the total possible credit points. But the core criteria have to meet each criteria 55%. Then in step 2, the publication of the quality report, if the KQ procedure ends positively, and the quality report describes the specific performance of the hospital and makes it transparent to the public, so then we also start to publish publicly accessible, in the internet normally accessible, quality management report of the KQ certified hospital. Next. And this is the procedure I just told you about. Next slide. Then they receive the certificate after 3 years, not 2 years, sorry.
So, we spoke about the initiative of patient safety founded in 2005, and we spoke about, and I think we managed to hopefully make clear the importance of patient safety within the certification process of German hospitals. Now the last question, and only a few sentences about the education of hospital managers. If you use the catalog not only for assessing hospitals, but also for training hospital managers, you have seen all hospital managers are aware of these questions and are trained to answer the questions and to think about what we can do to secure the safety of the patient, it's also the educational aspect of training of hospital managers. Indeed, there is a KDQ training. It's a 1-week training concentrating on patient safety, but also with all the other categories, subcategories, and the 63 criteria altogether. Yeah, and so the training is part of the academy. KDQ is offering the training. So, as Mr. Diebel said, that's the aim of the German hospital, of course, which has undergone the certification process to have a certificate at the end, and the certificate shows that there is quality management in process, that there is a certain standard of quality reached, and of course also the patient safety secured, because remember, 10 core criteria and 7 of the 10 core criteria are dealing with patient safety. Thank you very much.